How does the situation right now compare to last year?
We have more patients. Our patients are sicker. Our teams are tired and exhausted, too.
In a COVID ICU unit at the Cleveland Clinic's main campus, 25 patients struggle to hang on. As soon as one recovers or dies, another moves in.
We're seeing patients in their 20s, in their 30s, in their 40s.
Good morning.
Nurse Tim Washington came on at 7 a.m.
First thing I did is kind of look in the room to see if my patients were still there.
Still alive.
Still alive, right.
And they are today.
They are today.
Most patients here are on ventilators. 90% are unvaccinated.
Do you personally feel anger? What do you feel?
If I say I didn't feel anger, I would be lying, because this can be prevented with vaccinations.
There was some good news today. A new study from Southern California finding the Omicron variant is less likely to lead to hospitalization, ICU admission, or death than the Delta variant.
Those infected with Omicron who were hospitalized had a shorter duration of hospital stay.
But the sheer volume of Omicron cases is straining the system. At the Cleveland Clinic, 5% of the staff is also out sick. National Guard were called in to run testing centers, clean, and deliver meals. Respiratory therapist Myron Drisson used to be assigned to 8 patients. Now he'll sometimes cover 17.
When that alarm clock goes off in the morning, it's a little bit, here we go again.
People come to the Cleveland Clinic from all over the country for specialty services or surgeries. But right now, because of the COVID situation, no elective surgeries until at least January 30th.
That's actually the rationing of care.
Nationwide, ICUs are 82% full, a pandemic high. Dr. Hassan Cooley, who heads critical care at the Cleveland Clinic, says if their ICUs grow more crowded, it could be devastating.
I guess this is a morbid thought, but does that mean that somebody that comes in with a heart attack might end up dying because they can't get into your ICU?
That is possible, or they would wait in the emergency room, waiting for a bed in the intensive care unit, or they may be actually crashing on the floor.
In the COVID unit, 73-year-old Ron Perelka is vaccinated but not boosted. He has an underlying medical condition.
I'll tell you, I was the last one to think that I would get it.
What would you say to people who think that Omicron is mild and it's no big deal?
I'm willing to go walk out the door and they can come and sit in here and see what it's like.
He was one of the only ICU patients even able to speak. Kate Snow, NBC News, Cleveland.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.